All right, Lauren, thanks so much for doing this. First off, thanks for being here. And my first question that I have for you is tell the audience a little bit about yourself and how you started in the work that you do today.
Yeah, of course. So, I work in the mental health field. It honestly started with my own mental health journey. I went through a lot before I kind of found out what worked for me. Um, and that experience helped me to realize just how many people struggle, with the same things across all ages, not just my generation. I think that's what really kind of fueled my passion to support emotional healing, especially for the minoritized population, in helping people navigate life after trauma.
hmm And what does that look like for mental health in the mind in the for BIPOC and people of color?
Yeah, of course. That's a good question. So I am pretty new to the field. I am still an undergrad. I graduate this December with my Bachelor's of Science in Psychology. Um, but I can say crisis intervention and trauma-informed care is a big thing in, kind of helping, supporting people with life after trauma. And that could just be um, identifying protective factors like a person's support system, seeing how well, you know, um, their families' relationships are, their friendships are, how school and things like that, if that makes sense.
It does. So how did you end up knowing Dr. Ruth Brown? She was another guest on my podcast.
Yeah, so she's amazing, first of all. Last summer, I applied for a summer research internship or fellowship, you could call it. And I got accepted, and the mentor they placed me with was Dr. Ruth Brown, which was a blessing in disguise because we just clicked. We are the perfect pair. So that's how I got started working with Dr. Ruth Brown.
hmm And what has it been like working with her?
Amazing, eye-opening. She has taught me many skills such as patience, professional communication, community engaged outreach, data analysis, as far as things that help me kind of elevate in my career. Data analysis, working with different coding like R, RedCap, things like that. She's even helped me with projects. I've got to collaborate with her on a couple different projects. And we have a couple more coming up, which I'm super excited about.
hmm And so I forgot to ask, what is it that you currently do now? Because you talked about, what was like, working with Dr. Brown, but how do you sort of translate what you've learned into what you're doing?
Yeah, no, yeah. So right now I am currently a research coordinator for the Hope Lab at Virginia Commonwealth University. We study mental health in the intellectual and developmental disabilities community, but more specifically focusing on Down syndrome. Our work really centers on advocacy and the overall well-being for the community. On a day-to-day basis, I connect with different people, potential study participants. I do a lot of community engaged outreach through social media, conferences. We just came back from Dallas, and we're actually going back to Dallas for the Black Down Syndrome Association conference in November. So we're really excited about that. But conferences are my favorite because I get to talk to people face to face. Ever since COVID, a lot of things are hybrid, but for me, I like to feel connection with people. So talking face to face is definitely something I look forward to. And I also make sure that we follow all of the, IRB guidelines.
hmm Yeah, like face-to-face connection is really, it's real. I really like that as opposed to
Yes,
like over a screen. Yeah,
agreed.
yeah. But like, what have you learned in doing this kind of work?
That's a good question. That not everyone is not the same. Everyone has different, their different needs. Um, just how to communicate with them is different. I guess just not one size fits all is something that I've seen emphasized in the kind of work that I do. And I think that's especially important for person-centered care, practicing person-centered care in general within research or, um, being a clinical psychologist or therapist or anything like that.
Mm-hmm. And I always ask guests this, what's one thing that you still hope to learn in terms of something new? Like if you want to check something off your bucket list, what would it be?
Good question. I haven't thought of that other than like in terms of, I think learning different ways or more effective ways to be a leader and a mentor. Um, yeah. I think that's what I have so far.
Mm-hmm. And you said that there were earlier that you said that there were like events that you guys that will be coming up. So could you mind sharing about those?
Yes, of course. So, as I said previously, I like to focus my work on trauma-informed care for the intellectual and developmental disabilities community. I just um submitted an abstract to ISTSS, which stands for the International Society for Traumatic Stress Studies. And so the project that I submitted was a program evaluation of trauma-informed care for adults with intellectual disabilities. And it got accepted. So we will be, or not we, but I will be presenting in Baltimore September 18th on the program evaluation for the thriving, the thriving care training is what it's called. Um, so yeah.
Mm-hmm. And finally, what sorts of tips and advice would you give to folks that are entering the mental health field that want to learn what you're doing and kind of the work that you do?
I think the biggest thing is to understand why. You have to find within yourself, why do you want to do this kind of work? And then understand that, a lot of people go into this work to try and heal themselves, but when you are in the work to help other people, it's not about you, it is about it's about them and what they need as a person, and also about their support system and trying to figure out better ways to strengthen that support system.
Mm-hmm. All righty.